Welcome everyone. We had an extended summer break. We are very happy to be back with you all. Kathy and I are excited to continue our conversations. So let's go ahead and kick it off. If you're new to us, we're going to have a little bit blurb about who we are. So Healthcare User Group, we are a virtual group and we focus in on the healthcare industry. We're here to help anyone who works in the healthcare industry, no matter what flavor that is. And we are an official Trailblazer group. We are covering different topics when we do meet together. It's more like a webinar, interactive group. We do love participation and interaction, but we usually try to focus on a group and make it a little bit of a sharing and education, help lift us all together. Not only do you have these virtual meetings, you also have the success community. You have a Healthcare User Group, which is our group as a Trailblazer group. You also have the official Salesforce Health Cloud community group that anyone can join, and Salesforce themselves will actually moderate that group. YouTube, we do put all our recordings on a YouTube channel, so you're welcome to go and see the past meetings and go watch them there. And of course, we have each other. I'm Tina Woodall. I have over 16 years of IT healthcare experience. In 2017, I was introduced to Salesforce and grabbed it with both hands and have been very fortunate and thrilled with where it's taken me. And the fun fact is I do have a gecko wall art addiction. Kathy, you want to introduce yourself?
Sure. I'm Kathy Ackberry. I've been working in healthcare for over 20 years. I've been working in Salesforce specifically since 2010. I do a little bit of classic and obviously Lightning now. But probably like the funnest fact about me right now is not only that I jumped out of a plane, but I also just got back from Istanbul and spent some time there experiencing the old and new and the dynamic of that. So that was a really good trip. But I look forward to working today with OmniScript and OmniChannel. We are using that in one of the projects I'm working on. And we did have some bumps and we had some great outcomes. So love to share a little bit more about that and learn more about what Tina is going to share with us today. Please post your questions in the chat and we will get to them at the end. And Tina, back to you.
Thank you, Kathy. So our agenda today is we're going to do a provider management recap. And that is for those of you here who do not have familiarity with the provider management in the health cloud arena. So if you don't have any visibility in that, we're going to do a high level overview of that. And then we're going to jump into the provider network management. And as I said, this is being recorded, and then also we will share out the slide deck.
I thought we were doing OmniChannel. I'm so sorry.
It actually, OmniStudio supports it, but it's an Omni, it works. I'm with.
Okay.
And for those of you who don't have a lot of familiarity with provider management overall, our April session had a deeper dive into that. So I encourage you to go to our YouTube channel and look at that April session as well. But let's just talk about overall the provider journey overview. So when we're looking and we're talking about provider management overall, we're looking at recruiting, credentialing, contracting, onboarding, self-servicing, and adequacy. This is a picture I stole from Salesforce. And when we look at the colors, the deep blue is Salesforce itself, Vlocity is the teal, and third-party systems is the red. So this is the overall process. And within them, there's obviously much more granular information, right? So we have the recruiting, you can provide a recruiting, provide a registration, and then we get into the application and the verification of their information, the contract part. So these are just your general categories, and you have more nuance of what happens within there. But if you understand just the top part, recruiting, credentialing, contracting, onboarding, self-servicing, and adequacy, you're going to pretty much have a great overall roadmap on how this comes together. With Health Cloud, the provider management part, just Health Cloud itself already comes out with a frame for provider management. There's a provider data model, you have provider search, and you have provider cards. Provider cards is where you can basically take provider information, put it in this nice presentation component, and you can put on your Lightning pages. So those who need to see the provider information, you're bringing in different junction objects and sharing that information in a concise, easy to view component, as it were. Here is a high level view of the Health Cloud provider modeling. And this is not a great picture. This is the best I can find. I know it's on Trailhead. The only way I can find a clearer picture of this is if I actually recreated it, and I don't have the time to recreate it. But basically, this is the one from the Trailblazer group. Trailhead. So when we're looking at this, what we have is the Health Cloud provider management. You have your account, which is your businesses, your contact, your providers. Your account hierarchy is used, and you have your account contact roles. What I want to point out to you also is there's the healthcare provider and healthcare practitioner facility. And these right here are your key objects for provider search. So we have here is your account. We've got your contact, your healthcare provider, and your healthcare practitioner facility. I really want you to latch on to these 4 objects. These 4 objects are your foundation when you're looking at doing anything that you're going to scale from Health Cloud to any other functionality, whether you're using in Health Cloud provider search or when you're looking at provider network management. Any questions on that high level overview of Health Cloud before we jump into the provider network management add-on module?
Tina, you could never do this without the Vlocity add-on, right? You would have to have the Vlocity to go with this high, not just Health Cloud, but also download the Vlocity package on top.
So what we're going to be talking about, the provider network management, could you manage the whole process without the Vlocity tool? Yeah, you could. You would be spending a lot of you'd have to really fund the time and effort and energy and developer resources to match what Vlocity has. And actually, that brings a funny story. I was a couple of years ago, new in my consulting journey, but I'm familiar with provider marketing, i.e. when home health agencies, when they send out their liaisons to go market to local providers as well as hospitals and saying, hey, send us your patients, send us your business. And I was seeing a Vlocity overview and I'm like, why would you pay for this? And people are like, what? And I'm like, it makes no sense to me. Why would you pay for that? Looking at from the provider management, from a from a promotion standpoint of saying, hey, send us your business, you only need Sales Cloud. And if you are tracking referrals, you can minimum do Shield and use personal accounts for the patient. You don't need anything more fancier than that. You don't even need Health Cloud for that. If you are looking at doing some overview recruiting, you can with Health Cloud. You do have out of the box with that data model is you do have here your credential information. You do have a lot in Health Cloud to do it. The differences between Health Cloud and the Vlocity offering, the provider network management tool, is they have taken all that automation, that heavy lifting, to provide a true smooth, seamless process of scripting and having your employees going through and using the scripts to gather information from your providers, and then also for your providers to be able to self-provide the information. And it's just overall, it's been intensely powerful. So apologies to those who listened to me a couple of years ago. Why would you even do this? You don't even need this. You can do a lot of it yourself. It's true, you can, but where the tool stands today, when I show it to you, it's really, really powerful what it does, and really, just like Flows made clicks, development easier, accessible to admins with clicks. Vlocity, which has a steep learning curve, but when you master that, it actually provides more in your back pocket as well.
Thank you for that.
No, thank you for giving me the opportunity to share that. And that was so funny too. I was like, this doesn't make any sense. And people look at me like, no. And I'm like, So it's interesting how the tools evolve and emerge. Anything else before I move on?
I think we're good to go. I think there was just one thing about OmniChannel again, and we'll get to
it. You're going to say channel through the whole thing. It's studio.
Video. I am.
Everyone's going to leave here saying OmniChannel.
I'm jet lagged.
And Andy, it is the provider network management. Yes. So when we talk about provider network management, what the heck are we even discussing? And basically, I stole this from Salesforce to simplify how you find and manage provider partners with our provider network management application. Application provides you the key workflows to recruit and credential new providers, offer self-service tools, and manage networks. It just really gives you all the juice of what makes an application awesome versus having to build it yourself, right? It just gives you really powerful tools for that. The target market for this is really customers such as payers or mid to large healthcare organizations have a payer component. So that's really your focus for this provider network management. It is an add-on module from Salesforce that integrates with Health Cloud. It is an additional cost per user. The list price is $100 per user. For those of you listening, it's list price. No one ever pays list price. Just be aware. And note, effective summer of 22, just recently, the provider network management has been retired in Vlocity Health and Vlocity Insurance. It has been moved to Health Cloud. So it's really interesting when you're looking at the documentation in the standard Health Cloud documentation. It's a little light, and a lot of it will send you back to Vlocity documentation, but it is now been retired from Vlocity and is completely embedded as a Health Cloud functionality, or build onto that. When we're looking at provider network management, sorry?
I said good news. That's wonderful.
No, it is. With the provider network management, you have the application process. So that's the provider application. You have the recruitment and you have the credentialing. Those are the three things that it's covering in this tool. The data model, it's very, very interesting. This data model it's got an interesting twist to it. So Health Cloud traditionally is account as provider business and contact as provider. In the provider network management, they actually moved person accounts for the person, Dr. Bob, and the healthcare provider. So what they're saying is, what I'm assuming they're saying, or what their intent here is that the challenge has always been, you have Dr. Bob, the professional, and Dr. Bob, the patient. So when you have Dr. Bob, there's account contact, and then you have Bob Smith, you use a person account, and then there's a patient. How do you reconcile and have only one belly button record, as it were? And here in the provider network management, what they're doing is they're converting that lead to a person account, and then that healthcare provider is the professional Dr. Bob that's then linked to the person account of Bob Smith. And there's a lot of impact with that, and I have not played with this enough yet. I've really just been cutting my teeth on this in the last week or so, but looked at the configurations on, well, what if you use the traditional account contact? You have to use person account. It's a huge impact for organizations like I'm currently at Ascension, that they have a huge amount of providers in their Salesforce org that are not person account. What's the impact there, and what would that be to use that? So that's something to keep in your mind, front and center, if you're using this, that you'll have to figure out how would you resolve to that, how would you answer to that with doing it that way. On the overall structure and their data model, this is the provider application and credentialing diagram. And you'll notice I'm calling out again, account, contact, healthcare practitioner facility, and healthcare provider. You keep reinforcing that now that's moved into Health Cloud, it's built on Health Cloud. And this is, you use those 4 objects, whether it's account contact separately or as a person account, that's how they're building on that. And then this is the provider network contract management diagram. And here they are building on a healthcare provider and healthcare practitioner facility, because to them, they've already set up aside the account contact as a person account, and now they're working from the healthcare provider and practitioner facility. Any questions on that? Because there's a little bit difference on the data model and how they're working with that.
Nope. Just one comment from Cindy. The note section might be what you're looking for, and she provided a link to the Health Cloud object reference for project management data model. So I'm not sure if I missed something. Does that help you at all, Tina?
I'm not sure what that's referencing. So
I'm not sure.
Cindy, unless you want to send some clarification, I'm just going to go ahead and move on if there's no other questions on the data model.
Oh, sorry. I think that was just addressing what Kathy and Andy were talking about.
Oh, okay.
Oh, okay. Thank you.
Thank you. And that's awesome. And thank you. Any other links or any other information you all have, definitely please throw them in. So thank you for doing that, Cindy. All right, another component with a PNM is these are the exclusive objects that are also provided with the add-on module. So some of this will make sense, the employment, contracts, and so forth. So how does this come together? So we already talked about there's application recruiting and credentialing. The provider applies on the portal. The recruiter or the recruiting department reviews the application, they approve, sends the portal invitation to the provider. The provider logs into the portal and finishes their application, and then the credentialing verifies the information and sends the contract. And by the way, I will have a demo. I'm not just going to PowerPoint you all to death, but I will do the demo of this. But I want you to all pause and realize, if you've never worked with the teams that do this, this is so heavy on paperwork. This is such a painful paperwork process, huge painful process. And so being able to provide your providers the ability to, enter their own information is pretty typical with your large payer organizations. It's the smaller payer organizations that don't do that. Think of a hospital that self-insures their own employees. Large hospitals, organizations, large business organizations actually do that, where they provide their own employee insurance. So, even though United Health and those already have these kind of portals, there's a lot of them that still don't have portals and they don't provide this. So having a portal where the provider can, apply to provide service to the members, and then having it where they can load their information and then someone else is reviewing it. And that automation is huge and very, very helpful, because this is a very painful process otherwise. So let's now jump into what this sort of looks like. So with the P&M provider application, they're going to portal. Basically, they're going to call experience now. I'm going to say communities, but the experience site. So they're going to a site, then they're going to come here and they're going to click on join our network, and they can also nominate a peer provider as well. So it could be that they have someone else, or it could be someone from the doctor's office actually, nominating all the people in that office. You can do it either way. So it could be either a person's filling it out or someone else is being nominated. Then once that's done on the community side, what's going to happen is it's going to create a lead. The lead then comes inside to Salesforce from the site, and then they're going to look at this information and they're going to base this call and say they're going to talk to the provider. They're going to validate the information they have. They basically attest to the process, and they submit that they have all this information, and they've talked to the provider, everything's correct, and then they submit to that. What happens is at that point, the system creates a personal account in the healthcare provider records. And then it also is creating the provider specialty NPI and provider application, and it sends to the provider a link to the portal and is saying, here's your application. Go to here, we approved you, go to the portal and finish your application process. At that point, the provider logs into the portal, updates their application information. So the provider is going to go into the portal. Now, this is wonderful and also so nice is that CAQH is one of several provider data hubs, provider data companies. And CAQH is used commonly in credentialing and saying, this is Dr. Bob, this is his number, we have all this information on him. So what happens is you have an integration through API to be others as well. And what will happen is Dr. Bob here is at the portal filling out his application, and he can put in his CAQH number or other reference number, and then it will pull down all his information. Again, it's about streamlining and making this process as easy as possible and as accurate as possible, right? Because it's going to be pulling it in from a validated and verified source. So then basically it comes in, information is populated, it displays, he validates it, and then goes through the whole process. Now, after he completes the questionnaire, you can have a DocuSign integration. And at that point, it creates the document, and then the provider can electronically sign that application. When the application is signed, then all the information is updated in Salesforce and the appropriate objects. And then a case is created. So then it goes back over to the company, and those who are responsible for reviewing all this information will get this. I'm going to pause so I can take a sip of water and see if you have some questions, because that was a lot to step through.
So I do have a couple questions. First, Mohammed, yes, we do record all our sessions. They're available on the YouTube channel. And Lori, thank you for providing that link for them. The other was, is there anything you're talking about the payer side? And I believe in this presentation, Tina will talk about the payer portion of the P&M process. It's going to be later in the presentation. And then we do have a session next week or next time about the payer model for Health Cloud. Back to you, Tina.
Thanks. So there could be two ways of looking at that. So this is provider management from the payer component if they're looking to bring in providers to help just service their members. If you're looking at the payer modeling and how that all works as a payer company beyond the provider management, that session is next month, and we'll really start going in, and Kathy's going to help lead. Kathy is going to be doing that session. I look forward to seeing what you got, Kathy. But basically drilling into how, Salesforce Health Cloud is used in the payer world and managing their processes, because there's a lot to it other than above and beyond provider management. Okay, so they come and complete the process. So now what's happened is back onto the payer company side who's doing this, they're going to get notification that they have this information. And so they're going to call and they're going to get the provider on the phone. They're going to talk to the provider and say, hey, this, we're going to go through the questionnaire. We're going to see all the information the provider and put in there, go through and verify it. Has any information changed? No. If it had, they're going to go through the whole process of updating, re-signing, and so forth. But then once we verify all the information has not changed, it's good. And if they are approved to become a provider to take care of the members, then a contract is created and sent out.
So a couple of questions. First, do we have to use DocuSign? And is it included with the Vlocity package?
No.
No.
DocuSign is the one that is used in this demo org, and so this is why the verbiage is around that. But you could end up using other products, however you wish.
The other question is regarding CAQH. Does this limit the functionality to the US, or can we substitute outside sources for when they're using it outside of the US? So worldwide, would they have to, how does that work in somebody who's working in a global organization? Do we have any, that's beyond my scope, so.
This would be an API integration with whatever source you'd want. You just have to do the configuration for it. It's just for whatever reason for the demo org, they were using CAQH along with DocuSign, but it's just API callouts. You just do the configuration for that.
Sounds good. And yes, all presentation slides are available in the community.
Yes.
That's all we have for now.
Awesome. Okay, enough talking. Let's start showing. Can you confirm you still seeing my screen? Do you see the Salesforce?
I do, and I see live Google. I'm sorry, I have a bit of a sore throat, so I have a cough drop in my mouth. Yes, you're fine.
Okay, awesome. So here we are, and looking at this. This is a spin up demo org from Salesforce. It's a little quirky, I gotta tell you. And it was great because it allowed me to, get it to the point where I can actually do some showing of this for you all. So I'm very excited about that. But the biggest thing that fought me was the site. So I can't show you everything. I can't even show you how the provider fills out their application, but I can show you some things. And it's probably going to error out on me. They kept on airing out, and it got to a point I'm like, I only have so much time. So here is the OmniScript where we come in and we say, okay, you can fill this information. I, as a provider, am interested in coming to provide service for your members. So they do this autofill just for demo purposes. They come in and they look at this. Now there is part of provider network management. They actually have validation. See, I'll snap. I don't know what's going on with this demo org, just an FYI. If you actually, you're a consultant and you want to show this to a client, you'll have to figure out why this keeps doing this. Or showing this to y'all, I'm not worried about it. But basically you come in, you fill it out, and then there is validation. It looks at name, first name, last name, and email address to validate this. Now I already have Anna in here, so I'm not going to save this. And then the other one is you can then look at the nominate peer provider. And I don't know, this one's been glitchy. It's not always coming up. Well, this is where they do this. And I'm not sure if it's why it's doing this, and I'm assuming it's because it's demo org. And like I said, I didn't, at a certain point, I gave up. Oh, finally, I gave up. So that's what you do is you put on your experience site. And I'm not sure, like if you had a Sitecore site, if you could end up embedding these in a Sitecore, I'm not sure, probably. I think OmniStudio overall has some functionality we can embed into Sitecore. So that would be something really interesting to explore instead of using the Salesforce site. If you would end up using, if you have your own existing website, so you may want to embed it in that, that would be something definitely worth exploring. So now the provider has put their application in. I'm at the recruiting tab, so it's going to go to it, but you go there to the recruiting tab if you're logging in. And now, if you had today's leads, you can look at that. You do provider search here, but I'm going to go to leads because that's what I have. And I already have Anna, and I put her in before. So I'm going to go to the Anna. And what happens is typically what we're used to in Salesforce, we will just deal with the information and we would go through the processes. But what's happening here with OmniStudio, the provider network management, is they offer out of the box this enhanced tools. And this one right here is recruitment. And I'm the recruiter calling the provider who has put in their application. And then it says, this is a script. And that's the beautiful thing, right? You're basically scripting what you want people to go through. So am I speaking to Anna? And they're like, no, it's not Anna. Would you be able to connect me? And they say no. Goes through the whole process, right? Well, yes, I am speaking to Anna. Click next. And now it's taking me through the information that's been filled out in the application that's so far to date. You know, it's just a basic. There's just showing interest here. And I'm like, oh, okay, this is the information. And then I have to select which one I want for, you know, which network they want to be part of. And it just keeps on going on. Now notice there's CAQH ID, and you can reconfigure these. You don't have to. These are open. This is not closed. This is open, and it's encouraged that you can go in and modify these to what you need. I recommend you clone them and then modify it. And so it's not like this is locked down proprietary. This is wide open. OmniStudio is very much like, go make these your own, do as you wish. So I'm going to go ahead and take advantage of autofill, but I do need to change a couple of things because I've been playing with this so much, and it does have a great checks in here to make sure there's not duplicates, because it would have given me an error message if I hadn't. So that's great that it's already got all that validation in there. It's already double checking everything. So service location, and now here when I select to confirm and I hit submit, this is when it will now create that person account. It's going to go ahead and create, send the email inviting the provider to come to the portal and fill out their information. And if we come here, we'll see at this time we don't have a contract, but we do have our healthcare providers created, our healthcare provider specialties, NPIs, and then after our provider fills out their application, all this other information will be filled out. Any questions on that part from the lead to this process and using that tool that we just did?
So the first question we have is from Crystal. She wants to know what licenses are required to be able to add on this package and provide that to the users.
You will need the Health Cloud license, and you're going to need also the provider network one as well for the permission set.
The Vlocity, or is that the Health Cloud?
No, so you have Health Cloud, and then you also have provider network management one, and you have to buy those. So that this is where the provider network management, that's an add-on, and that's where I was saying it's $100 list price. I stress list. So you would have to go and get
Oh, this isn't it. The next comment is interesting. So, okay, so they have to download both packages and then they have to provide licensing to both.
Yeah, and I'm trying to look, it's not called provider network under here, which is really weird, but you have to get that additional add-on license and you sign it through the permission set. So.
Okay. The other question we had was about Salesforce editions. So Andy said here's the pricing info, but he also said that Chrome crashes all the time when I'm in development. Support told me to use Edge for better stability. So that's interesting. First time I've ever heard Salesforce say use Edge.
Wow,
but it's gotten a lot better. So there is that.
That's a good tip. It's really quirky trying to work in the portal on this one. It kept crashing even when I was doing development on it, and looking at all the different scripts to add to it. It kept crashing.
So Erin, is that just specifically to what Tina's working on here, or always? Risk Connect support, not really Salesforce. But still, it's good to know we can switch to Edge, and maybe that will help us when we're being a little buggy. So thank you for that.
Yeah, no. Any tip helps.
Yeah, we'll take it.
Okay, so now we have our person account, and in our process, let me go back up. So where we are at is the lead we've done, and now they have the application, right? So the provider is filling out the application, and then it comes back to credentialing. So that's usually a different group, and with credentialing, they're having to go through the process, and what they're getting is, we'll go over the credentialing section here. What they're getting is what they call a interview. Individual applications, and then they look at the individual applications and they're going to review that. So I did Anna's, I think, yep, that's her. So you can go to the application and they look at that. Now, keep in mind at this point, there's going to be a lot more information here. There are going to be tons of information attached from the actual application itself. And this is what they'd be looking at. And they'll go through and verify that. But what they're really going to also be looking at and going through is this primary source verification. So they can look at the individual application, look at that information. But now they're going to go through the primary source verification. And this is pulling forward all that information off the application, because now through that process, they're actually having to verify the information, right? They have to go through and say, okay, this is what the provider attested to. We confirm, okay, do we then say everything's right and accurate, meets our criteria, and then we send them a contract. So here, this is the step through, and this is the script. And it says, hi, I'm Tina Woodall from SFCC Health. You're registered. I'll take you through the steps. And then we start going through here. Now, unfortunately, I do not have a provider to have filled out information. So I'm going to try to skip things. It's going to be like, no, you can't. So I'll take it so far. But basically, the really nice thing is you can be reviewing the information that was, submitted, and you can correct as you need to go and go through here. So I'm not going to spend all this time doing this with you all, but it gives you an idea. And this is where I was talking about the power, right? So here's the thing, when everyone is usually doing this process, that it's very labor intensive. Well, having everything provided in an electronic format is priceless for going through this. So I'm not going to finish this, but this is what you have and that you can go through. And from here, you basically make a decision and say, okay, we can send them a contract or not. And then the contract's sent, and then the provider will get the information, and they'll go back to the portal and they'll sign the contract. And that is what provider network management provides. It is providing the ability to streamline your process to manage the application, recruiting, credentialing. And this is intensely labor intensive. And you can see by integrating the provider portal how that streamlines everything. And through having those scripts is really priceless, because then if you change things, organizations, the business decides to change things because requirements change all the time in the payer world. You can update the scripts, and then it's right front and center of your employees who are having to use this tool. And it's just right there. It's updates. You can train them, but they're going to forget. So you update the scripts as well. It's right there. Follow the script. Boom, they're gold. Any questions or anything else you guys would like to see in the actual application on that part?
Do you think showing the script, how the script's built out in the back end be helpful from the admin point of view?
Oh my goodness. Why are you doing it? I thought you liked me, Kathy.
Sorry. I just thought that, to me, I thought that was very interesting. I was working on a different project, and being able to just the capabilities of what you can do with within the OmniScript to be able to make updates to the record that you're working on is very helpful.
No, it is. And actually, I do have one more slide. We're going to talk about the admin part. But I'm just laughing. It's like, why are you doing this to me? Because
Yeah, it's difficult. It's a big learning curve, I think.
Oh, it's huge. It is huge. So with part of the provider network management package is these scripts that are part of it. So it comes up with a registration script, denomination, recruiting, credentialing, and primary source verification, OmniScripts. So this out of the package is what's delivered and sets you up for success. So that is what's delivered. And when you come in here, the other component you really want is, here is your admin, and this is where you would live. You can do OmniScripts and the integration, data wrappers, and so forth. And to the point of what Kathy was just saying, is learning these is huge. And that brings me to my last part on here. Is this worth it? In Tina's opinion, is this really worth it? I'm a huge advocate for it. I think it's a great tool. It's a very, very powerful tool. It can have a significant impact in streamlining very complicated processes, but it is a steep learning curve for OmniStudio. If this is being considered for a company, you need to learn OmniStudio because you have to support it. So even as a company, they hire consultants to come in and implement this. Sooner or later, the consultants go away. There needs to be an investment by the company to nurture and grow their own staff to understand OmniStudio and all the components of that, and to keep going and using this. Because if you don't, I personally wouldn't recommend it unless there was a really willingness to invest in having the own employees having some, one or two that actually own the knowledge of OmniStudio and understanding this. I mean, Kathy, what are your thoughts? Because that's my feeling on this.
I agree. And I think that once you do that investment, the opportunity to really grow that, the OmniScripts or whatever you're doing with OmniStudio is really endless. There's it just, from what I saw, just working on a small project, right? They have just a logic. It's like, I don't know how to say it even. It's just just the ability to really grow your organization and be able to do so much more for your users and so much more for your providers, and to streamline processes and automate things is really fantastic. You can set tasks, you can do all kinds of things just through the scripting. It just gives you a lot of opportunity to do things, and it's worth to make the investment, I think, in one of your own staff members.
Absolutely. I was thinking for one of the things is that scripting is very useful for call centers, contact centers, because that scripting to me can apply in so many ways. When you're looking at like this, and you're just looking at kind of any scripting, right, to go through and gather information and the next best actions and so forth. This can be, it's just a great tool. And it's, yes, we have screen flows, and I don't disagree, screen flows can help a lot, but this is a much more powerful lift and has a lot more functionality and what it can do and the power of that. So that's another reason. It's beyond screen flows. Screen flows are powerful and they do take you so far, but this is beyond screen flows.
And really, flows are meant internally. They aren't always meant to be used externally, whereas OmniStudio is meant to be external.
Right.
And that's to be able to use with your customers, with your patients, with your members, if you're working with payers. It's also for your physicians. It just gives you a lot of opportunity to grow your organization, to make those processes available to your end customer versus having it just internal and having your own spending that time on the phone. Let them be self-serving, right? And be able to move forward on what they're working on. Because how many times you waited for a phone call to get back to only walk through it with another individual on the other end of the phone, when you could have probably just done it yourself while you're waiting to get the phone call through, and that work could have been completed. So I'm just saying, it does make everybody's time a little bit more optimized.
Absolutely. All right, resources. And this is why we definitely share out the deck. To set up and manage your network of providers and Vlocity Health Insurance options available. These two are really good resources if you want to cut your teeth on this. And then here's the overall general Salesforce Health Cloud resources I'm always recommending for people to use this if you're getting new into Health Cloud. And if you want a free 30-day demo org, these do not have provider network management in these, but overall these have great Health Cloud, different kind of flavors of how they're spun up. These are good to just spin up for 30 days and play with it. And I always find that having an org already pre-configured and then trying to break it and follow the guides is really useful, and it helps me learn much quicker than muddling through and trying to figure it out that way. Whew, I don't know about y'all, that was a lot. Any other ideas or any other questions or thoughts on that? Does anybody think that this would be something worthwhile for their company or their clients?
No comments in the chat, and we have 21 attendees, and everybody's still on mute, Ms. Tina. So I think if you do have something, you are still muted. You have an opportunity to unmute now if you do have a question, or put it in the chat. Be happy to answer it. And I think really we need to know is who is working in an organization where provider management is a big concern, or are they using something else at the moment as opposed to using Health Cloud? And how many people are using this for certification purposes? That'll be a good question too.
So using this for certification purposes?
But yes, viewing our session today to learn a little bit more about this so they can take their Health Cloud accreditation exam. I know that there was a comment earlier from one of the attendees that they had reached out to me. So
I'm sorry, I didn't know if those were commentaries or if there was a question.
no, there's no questions.
Okay, I was like, did I just sort of kind of like blip out here for a second?
No, I'm trying to see if I can draw some questions out of our attendees today, but I don't
Everyone's
think
quiet. It's all good.
it is
Quiet
raining.
lately.
Maybe that's it.
Yeah. Well, next up, we have October 13th, payer management. Kathy's going to be leading that one. I'm very excited about that. And November 10th is save the date. No idea what we're going to talk about. Who knows? If you guys have a topic you want us to cover, please let us know. If we don't know, we'll go learn it. I always like doing these because it makes me go learn something. And so I enjoy that. But is there any topics or burning things that you guys would want to know?
So,
I think Tina.
No comments there, but we do have one. Go ahead, Cindy. We're not sensitive. We've got somebody connecting to audio.
That was
Marlene?
Marlene had a question.
It would be fun if maybe we had a session on the Health Cloud accredited professional accreditation. Sorry, I got my words all mixed up today. Health Cloud accreditation certificate.
I can't.
I think that's a good.
I can't.
Oh,
I was
we
from the
can.
group that made it.
yeah.
I had to sign a
Oh,
non-disclosure.
I didn't know that.
So I was on the group that actually helped me because those questions, and so I had to sign an NDA. I can't.
I didn't know that. Well,
Yeah,
okay.
sorry.
We'll have to.
Hi, Tina
have
and
one more-
Kathy. My name is Doug Kintawi. I'm sort of new to the ecosystem, about 2 years in. I know
Doug froze.
seeing
Yeah.
Salesforce first, but knowing that Health Cloud is an up and it's a booming business for Salesforce. Wondering how do we get into projects that would get us into Health Cloud aside from the super badges and attending this meetings and such. Like how can we, I guess,
Are you working with the
advertise that
consulting
we have
firm
that
now?
background and be included and start playing with it.
Doug, are you working for a consulting firm now?
I work with you, Kathy. Actually, I work at Coastal Cloud.
Oh, hi. I'll see you at All Hands next week.
Yeah, I'm in
we have-
nonprofit and education, but obviously 20 years as an allied health professional, kind of familiar with the lingo there and might be more business process knowledgeable than what I'm doing right now.
Nonprofit. Okay. So if they put you in nonprofit, they probably needed somebody on a project at the time. We do have quite a bit of business going. We're very successful, fortunately. But you do need to reach out to your direct manager, let them know what you're interested in, and then they will. Another thing that too, this is specific to Coastal and probably most consulting firms. When you're working within a consulting firm, there's projects that go across the board typically, right? So you have these opportunities to work in different areas, and there's always gaps in our knowledge. Salesforce is a beast. Nobody knows everything. So having those conversations one-on-one with your manager about what you want to learn, where you'd like to grow, those are things where they can start to reach out their feelers and say, when there's an opportunity, hey, Doug might want to be able to jump on that project. He can help. So those are kind of how we work internally in Coastal. I'm not sure how other projects work, but usually your manager is the one that helps support that, and will move you to another, either to another team because of where your passion lies, or try to find how you can do both, what you're doing now and add on the other. So I've always found them to be very helpful in trying to help you achieve all your goals, and especially to give you projects that you feel like you want to work on and not something that you maybe isn't in your wheelhouse. So that's definitely one way to do. Yeah, internally for us, if you're working externally and you're not within a consulting firm yet, I think the best thing to do is to really add those keywords into your LinkedIn profile and beef up your summary on Health Cloud. And then if you are looking to consult, let him know that you're trying to make that transition from whatever you're doing to and within the ecosystem. And then on Salesforce Trailhead, there's much more opportunities to reach out, and Tina can talk to this part of how to do that within the Trailblazer community of exposing yourself to more individuals to be able to open yourself up to opportunities. That being said, on the Health Cloud examination, I do not have an NDA. It is only available to partners, so do keep that in mind. This is a Salesforce user group, So if you're not a partner, then that means that they're not available to take the exam. But for those of you who are partners, you definitely want to make sure that you're encouraging your folks to take that exam, and that also it's reflecting back on your partner information on AppExchange and also on within the partner network. And Tina, just a couple questions. I know you probably want to follow up with what I just talked about as far as the Salesforce ecosystem and increasing your ability to be recognized. The other is,
let me talk to Aaron and Lori first.
yeah,
And
let's
talk about the functionality, and then let me talk to that, and then let me pivot back to
yeah, because there's a couple of questions about our conversation today too. And you're starting with Andy's at 544 is what you're looking at.
Andy is more of a comment. It is great for the it reduces the heavy manual onboarding processes overall, and it doesn't have to be just in the payer or provider management at all. It can be used in anything. But to your question, Aaron, I would really look at first if FormStack or FormAssembly, which actually integrate with Salesforce and can be embedded into a website. So FormStack and FormAssembly, both, you can put them on an external website, and then they have anchors or hooks that will come straight into Salesforce. FormStack is HIPAA compliant along with FormAssembly. So if you have that nature, you can actually have patients go to a form and fill it out. Still has to get vetted by your legal and compliance, but then it's hooked straight into Salesforce, so it's secure in transit, and then it comes into Salesforce and then can create a case or a lead however you want. So definitely look at FormStack or FormAssembly before you look at something that's such a heavy lifting as OmniScripts. With the OmniStudio product. Those are the easier, faster solutions depending upon your use case. So I would encourage that first before you explore more, right, into the more complicated part of that. And for you, Lori, it can, yes. So sending out, to your point, sending automation around reminders, absolutely. So that's the beautiful thing, right? When you have expiration dates in Salesforce, you can trigger upon time-based workflow automation saying, hey, when this hits and it's 30 days before it expires, ideally, right? So you'll be proactive, send out reminders to the provider that they need to fill this out. And also, you have reminders internally to whoever was responsible for re-verification of that information. So you definitely put that into your workflow processes. As long as you got that field filled out, you can develop your workflow processes appropriately from there. So that'd be pretty easy. The implementation time with Omnichannel, actually OmniStudio, look at you, Miss Kathy, you got Marlene saying Omnichannel.
I know.
So what would you guess right now? Because like Kathy, you're right now going through an implementation with this. What would you say would be a component of that?
It really just depends on how much you're putting into the script, right? How long and how short it is. We had two that were relatively short, and we have one that was quite a bit longer. And I would think development time, probably 20 hours for the shorter ones, depending on how many tasks, and then for the larger ones, with the logic and everything, that probably 40 to 60.
And that's just development time. That's not the whole project of discovery requirements.
Right.
That's just the development time, right?
Correct.
And do you see it more enterprise projects, or mid-market is up to be?
Oh, this was enterprise. Yeah, this was a larger build. I would think that. I'm sorry, Lynn, could you ask your question again?
Just comparing like the size enterprise clients as opposed to mid-size that can handle Omni features. Because clients come to us sometimes and they want it all. They see these shiny things and objects they want to do, and sometimes it's right sizing it for them. And if they're mid-size, you may say, "Are you ready to handle this?" I just didn't know what you saw as a trend.
Yeah. I think you definitely have to have that conversation, because there's a desire, if somebody's using maybe a system that's different and more user-friendly or more trimmed down with features, to want to be able to quickly take this on. And there's a learning curve, and they need to be able to, and that's trying to help them understand that it is going to be a little bit more involved and it can break more easily. If you're trying to make just small changes, you could possibly break it. So, and you don't want to try to have to go fix it. And if it's something that they're using every day, and you do it in production, then it can make a big impact, right? So I think there is caution there with yeah. I'm gonna stick to more sleep. So I do think there's for a smaller build and a smaller and a mid-sized market, you're going to look at maybe doing things just a little different. You're probably not going to use all the logic, all of the bells and whistles, so it may make it an easier implementation. So I just think you have to really work with them. And of course, MVP is your best way to go, most viable product. Don't try to do it, try to increase too many features at the very beginning, give them proof of concept, and kind of slowly walk them through expanding that as they go up, move on. Is probably your best bet. And that way you can bring your Salesforce admin on the client side up with you at the same time as you're going from MVP up to, of course, using it more extensively. That would be my first suggestion. Yeah. And then
Go ahead.
the relationship, back to Tina.
Yeah, and I'm gonna hold off on answering that, Marlene, just I want to finish up through here. So continue the conversation. Please feel free to join or to see our YouTube group is at sfdchealth.com. It's a lot easier to do that. It's basically URL to YouTube channel than the long Trailblazer URL. And to join is join.sfdchealth.com. That takes you actually to our Trailblazer Bevy group where you can sign up for all our up and coming meetings. And when we're done and the recording is done, I'm processing, as it were, I will definitely send out an email to the group and let everyone know to go to the YouTube to go watch it, as well as to go to the community group to go download the PDF of our deck. So now with the part about networking, I think that was one of the things Kathy wanted to focus back on, the networking component of it, or you want to talk about that?
For our group, yeah.
Right.
So as far as networking for us,
Is it me or is it you guys? It's like it's gotten like draggy.
I think Kathy's breaking up.
oh, I could be. I have rain where I am, so that doesn't always make my internet work that great. So for networking, we do have LinkedIn groups, and then when you're in the chat, Tina is very good about answering all those questions. So definitely take your time to go through and look and see if there's something that you haven't, we didn't respond to you today, or something that you wanted us to add to this comment in this session that we're talking today. Is that what you were? I'm sorry. Yep. Good, Tina.
No, we're good. So unless there's something else, that was a good suggestion on topic. We'll definitely take consideration for that. But if there's any other topics, please reach out. Do not hesitate to reach out to Kathy and I on LinkedIn. I live on LinkedIn. That's my home, not Twitter, anything like that. I'm a LinkedIn girl. I think Kathy, you're pretty active on LinkedIn. So feel free to reach out to us there. And if there's nothing else, you all have a fantastic evening. Thanks all. Bye.
Thank you.
Thank
Thank you. Have a great evening. Bye.
Nice to meet you. Nice to meet you guys. See you next week. Bye.
See ya.
Bye, Ryan.
Bye.